We know insurance can be confusing, and we wanted to put together something that might help you kind of understand things from the common questions that we get or the common misconceptions about insurance that we hear every single day. So we'll start with a copay. A copay is a fixed amount that is set by your insurance that we as a practice are contractually obligated to collect. So this is for office visits, services, and things like that, and that number is set by your insurance. Your deductible is a set amount that you have to pay as the patient before your insurance starts paying anything. So you will have a set amount, and they should tell you that with your plan. And if you don't know it, you should be able to call the number on the back of your card, or sometimes it's written on the card itself. But that is the number, that's the amount that you, the patient, will pay before the insurance starts paying anything towards your medical bills. Plans have a co-insurance amount, and that amount is typically applied after your deductible is met, and then there will be a percentage. So a lot of times we see that your insurance company will cover 80% of your medical charges and you'll be responsible for the other 20%, but that kind of ratio with the percentages can change depending on your plan. And then once you meet your out-of-pocket maximum, that's the total amount that you, the patient, will be responsible to pay in a plan year. Covered service is misleading because when you hear covered, you think that it's zero responsibility to you, the patient, and that's not the case. A covered service is a service that is eligible for your insurance to pay. So something can be covered and you can still have a financial responsibility. That financial responsibility depends on your deductible, your co-insurance, and your out-of-pocket maximum. So just because something is covered does not mean that it is zero cost to you, the patient. We have a lot of patients that get upset because they don't understand why we can't guarantee them or give them an exact amount of how much their health services are going to cost with us. And that's because insurance companies are not guaranteed to give us any kind of promise of payment, anything like that. So all we have is an estimate. We have to send it through to the insurance for them to send us a final determination. You, the patient, have a little bit more power in that regard because you are a member of that insurance plan. So you are able to call and ask for more specific details on what's covered and what's not and what you may be responsible for. And it is always a good practice to get a reference number and that person's name. So if it is different at the end than what you all discussed, you can call them and fight that with them. We as the practice do not have that kind of power or that kind of leverage over the insurance companies, and it really relies with the patient. We are always here to help you understand your insurance a little bit better. For the most accurate information about your specific plan, the best practice is always to call the number that is on the back of your insurance card so that you can ask those specific questions. You can use this video to ask them specific questions about your deductible, your co-insurance, your co-pays, and your out-of-pocket maximum and what those covered services are for you. If you ever need the specific CPT code for a certain service, we are more than willing to give that to you and what we expect might happen at your visit so that you can get a more accurate idea of what you're looking at for your financial responsibility.